and thank you for joining us for this edition of Facebook Live. We are at the site of the VCU Health Ear, Nose, and Throat Clinic in Colonial Heights, and today we are joined by Dr. Ryan Nord, who is director of the VCU Health Sleep Surgery in the Ear, Nose, and Throat Clinic, and Ms. Gloria Crowder, one of his current patients. Today we're talking about some of the offerings of the Sleep Center, particularly treatment for sleep apnea. Additionally, we want to make sure everyone has good advice they can apply as we go into the first week of after daylight saving time has just occurred, which can be troublesome since we lost an hour of sleep. Is that right?
Right.
Did you guys feel it, or?
Not too bad.
Did pretty good?
Yeah.
Okay, all right, so we'll start with Ms. Crowder. Tell us what led to you visiting Dr. Nord.
Well, I had been on the CPAP machines for quite a while.
Okay.
And had tried numerous masks and techniques, and it just wasn't doing any good, and I just said, there's got to be something out there better. So I went on the internet, and I wanted the latest and greatest, and up popped Inspire.
Okay.
And I said, oh, so I started doing a lot of research with that, and it said, find a doctor. And I found Dr. Nord, who was close for me, and set up to speak with him to see if I was a candidate, because there are some tests that have to be done before to see if you are a candidate. And so I saw him, we did the test, and I was.
Okay.
So then we proceeded on to surgery.
Okay. Awesome. So that was exciting.
Oh, yes.
Okay.
Oh, yes. I was so looking forward to it. I just knew it was going to work.
Okay. Awesome. Now, how had you been coping with your sleep apnea prior to visiting?
Not well.
Okay.
Not well. If I got 4 hours sleep a night, I was lucky.
Wow.
And the CPAP machine that I had has a website that you go to, and it tells you how many episodes you have and how much sleep you're actually getting. I wasn't doing good.
Wow.
And falling asleep during the day, getting drowsy while I'm driving. Not good. Also loss of concentration, and the memory. It just wasn't there. I could tell a big difference. And so I just knew I had to do something. And that's when I tried to find a better way.
Okay. Now, one more question for you specifically. Now, I understand that you took a pretty drastic measure initially, resorting to surgery to try to alleviate your sleep apnea. Can you tell us a little bit about that?
Well, I was not the least bit afraid.
Okay.
I spoke with Dr. Nord. He explained everything to me.
Okay.
Of course, I had, done a little bit of research, not nearly enough, because he was very, very helpful to me. And I had to chance it.
Okay.
I said, it's got to work.
Okay.
It's got to work.
Now, I think prior to that, though, did you have a surgery for your weight, or did you have
yes,
to lose
3
your weight?
years ago, because I thought that might be my problem.
Okay.
I had weight surgery 3 years ago this past September.
Okay.
Lost 80 pounds.
Okay.
Didn't affect sleep apnea at all.
Gotcha. Okay.
So I tried that. I tried everything.
Okay.
I mean, not just the CPAP, but other alternatives to maybe help, and it just didn't. And I knew there had to be something out there that would help me.
Okay. Now, Dr. Nord, how was it determined that Inspire therapy was right for Ms. Crowder?
Yeah, so, in general, for any patient, it always starts with a thorough exam. And what we're looking at for, especially for Inspire, is starts with actually reviewing the sleep study and finding out how severe their sleep apnea is. This is a great procedure for people who have moderate or severe sleep apnea, which Ms. Crowder does fall into. The next is we do have to also look at their weight. Although this can be performed in people who are overweight and obese, there is an upper weight limit. So we have to make sure they fall within that range of weight, and she did as well. So she was good from that perspective. And then, of course, we just I do a normal exam and look at the patient's airway, assess their anatomy, see if there's anything that makes sense in terms of what we can do to help get the patient and getting her sleeping better at night. And then from there, and really to determine a candidacy, we have to do something called a sleep endoscopy. And that is essentially a procedure where we go to the operating room and we put her to sleep. And I looked with a thin, flexible camera through the nose and looked at the airway and saw the pattern of collapse. And there's different types of pattern of collapse, and there's different spots where the airway can close off. And thankfully for her, the pattern of collapse worked out really well for the Inspire device. So that's how we determined she was a good candidate.
Okay. And we've been talking specifically about the Inspire therapy as it relates to sleep apnea, but let's just take the time now to break down exactly what Inspire therapy is and how it works.
Yeah, so Inspire therapy, let's see if I have my model here.
Okay.
Yeah, so this would be the device. It's similar to, in size and shape, to like a pacemaker. And it's a generator actually and a battery that lasts for 11 years without having to be recharged.
Wow.
So it's implanted under the skin in about this position here, similar to where a pacemaker would be, but on the right side in case the patient later needs a pacemaker.
Okay.
And essentially, under the skin, this is hooked up to two other sensors, one of which goes into the neck around a nerve, and that nerve is a nerve that controls the airway muscles and opens up the airway.
Okay.
The other sensor goes between the ribs, and that senses when the patient's breathing in and out.
Okay.
And so essentially, the device synchronizes with the patient's own breathing, so that every time Gloria takes a breath in, the machine senses that and stimulates her airway and opens that up at night.
Wow. And how invasive is that procedure, the surgery?
Well, it's considered less invasive in
Okay.
terms of traditional sleep apnea surgeries.
Okay.
It is an outpatient surgery typically, so typically people do go home the same day,
Okay.
or at most go home the next morning. And it's 3 different incisions, so 1 incision again in the neck, 1 in the chest, and 1 in the ribs. And typically, there's not a whole lot of pain from that. Did you have much pain
No,
after
not
surgery?
at all.
Okay.
No.
Okay. How was your surgery experience?
Oh, it was just fine.
Okay.
It went well. There was no pain. I had no nausea. I had nothing. I hardly knew that they were there.
Okay.
Other than the fact that at one point they had little bandages on them, and then that came off. And
Okay.
that was it.
Okay. And so you showed us the device, and you actually have your remote. So can you show us how you activate
This is
and deactivate?
very simple. All you do to activate it is put it where your little thing is, and it turns on. And as you can see, it's connected to my tongue.
Yeah.
Because if I try to talk, things get a little difficult at times because it is connected to the nerve. Okay? Then to cut it off, I just put it back up here, push the little white button, and it turns off.
Yeah.
That's it.
Wow.
So, during the day, the device is off.
Okay.
Mm-hmm.
So, there's no issues with speaking or
No.
anything like that.
Okay.
And so that's one of the good things. There's no real alteration permanently that happens to someone's anatomy like traditional sleep surgery.
Okay.
So going, throughout her typical day,
Mhm.
there's really no difference in her speech, no difference in her swallowing or
No.
anything like that.
Right.
But when she is ready to go to sleep, she's able to turn that on and
Awesome.
activate the device.
Awesome. How big of a difference was that for you from the CPAP machine?
Oh my gosh.
Yeah.
They have this set up where it's kind of like a delayed as far as actually activating, gives you 30 minutes to go to sleep because some people don't fall asleep when they go to bed. And then it turns on where it starts activating. And I sleep fine. I don't wake up during the night hardly ever, And then in the morning the alarm goes off, I pick up my little remote, I turn it off, and I'm on my way.
Okay. And the sleep pattern machine, did you have the entire mask?
Oh gosh, I've
Okay.
had everything. I've had the nose, I've
Okay.
had the mouth, I've had the whole mask.
Okay.
I tried them all, everything
Okay.
that was out there.
Okay. Okay. Dr. Noor, how did VCU Health become part of such a small number of facilities who have Inspire or who can offer Inspire therapy?
Yeah, I was trained at Case Western Reserve and University Hospitals at Cleveland. And while I was there, I was lucky enough to be exposed and had some good mentors who trained me in how to do the procedure.
Okay.
And so when I came here, that was one of the things that I wanted to start.
Gotcha.
So we started up a program doing Inspire and also doing a number of other sleep surgeries for people who aren't candidates for Inspire. But you're right, it is something that's certainly not offered everywhere. There's currently 3 centers in the state of Virginia, and we are lucky to be one of them. Yeah.
Awesome.
So.
Okay. Ms. Crowder, how did lack of sleep at night impede your daily activities? And you talked about it a little bit, and you, in previous conversations with me, you talked about how it affected you even at work.
Oh yeah. I had to write everything down.
Okay.
I mean, it was really hard to remember. I was really surprised that it was affecting that faculty.
Okay.
Concentration, and I'd sit there and I'd be at my computer and I'd get sleepy. And I know, you know, you just can't. And I took a short trip, maybe an hour's drive. I got sleepy driving, and that one scared me. So I just knew it had gotten to the point, you know, that it had gotten worse. That it just was, I was so sleep deprived that it was really, really affecting my daily living.
And for how long had you been experiencing that?
Oh, let's see. I would say close to a year.
Okay.
And that's when I just said, you know, my sisters were saying, well, I told you that. I said, you did? I couldn't remember. And they said, you got to do something. I said, yeah, I do. So that's when I started searching for something out there.
Okay. Dr. Noor, what health risks present themselves from a lack of sleep? I've been told before that rest and sleep have restorative properties. So what type of health risks are associated with not getting the proper amount of rest?
Yeah, well, I mean, it's really two different questions.
Okay.
So, you know, if you look at how much sleep people actually get, you know, in the 1950s, on average, Americans got at least 8 hours of sleep. Today, it's more about 6.5 hours across the country. And obviously, we don't need less sleep. We're just getting less sleep because we're busy and distracted and pulled in too many different
I was going to ask
directions.
you what are some of the things you thought attributed to that, but
yeah. So even before you lie down to go to sleep, you know you're not setting aside enough time. So people really do need to know that you really, you know, pretty much without exception, need at least 8 hours of sleep. You know, 7.5, 8.5 hours. And you know, can you function on less? Sure, but it's not really going to be good for your health. In terms of sleep apnea, so for those of people who maybe aren't as familiar with exactly what sleep apnea is, sleep apnea is when you stop breathing at night. So when you're trying to take a breath in, your airway actually closes off completely or enough so that the oxygen level starts to drop down. And when that happens, your body essentially kicks into like a fight and flight mode. And that leads to a number of you know, poor health outcomes. So you know, the most serious of those, if you look at people who have severe sleep apnea and it's untreated, or meaning they have sleep apnea and are not diagnosed, or they're diagnosed but not using any therapy like their CPAP, those people have a 2 to 3 higher likelihood of dying, of mortality in general. About a 3 times higher risk of stroke, about a 2 times higher risk of having a heart attack. They're much more likely to have high blood pressure, cognitive impairment or memory issues. It certainly can lead to things like weight gain, poor energy. It can lead to worsening of diabetes if people have diabetes. It leads to actually insulin resistance and a harder time to control your diabetes. So that's just a short list of a number of different things. It really affects nearly every aspect of your life.
Right, and I'm certain those are things people never consider, but you're putting your body at risk.
Yeah, I mean, you know, what people consider is oftentimes it's the spouse, you know, the person who's in the same room or maybe even the same house, and has trouble sleeping because of the snoring that goes along with it. And so a lot of times for my patients, it's more of just maybe an annoyance to them. But I think, once you're aware of the health consequences and that it really is a serious issue that needs to be treated, that people become a lot more motivated, certainly.
Okay. And what actually is the body doing while we're sleeping? Or internally, what's happening that will cause us to be healthier throughout the day? That's
a good question. We really don't know.
Okay.
You know, we know that sleep is important for the brain's normal, healthy function. Whether it's, you know, there's different theories. One of them is called neuroplasticity, which means that when we're sleeping, there's connections that are being formed in our brain that are important for memory, problem solving. So if you've ever been thinking about a problem and you go to sleep and kind of think about it, maybe you come up with a solution kind of when you wake up or in the middle of the night. It's kind of that type of idea. So that's a thought. Or is it a time when cells are kind of resting and repairing themselves? That's certainly another thought. So to answer your question though, we really don't know for sure.
Okay.
We certainly know it's important.
Yes.
Without sleep, you can't live. I mean, truly, you can die from lack of sleep in terms of if you were to stop sleeping completely.
Right.
So it's an essential body function, and certainly important.
Okay. Ms. Crowder, what has your daily life been like since the procedure?
Oh my, totally different.
Okay.
When I wake up, when I was on the CPAP and everything, you wake up every morning with a headache. I mean, a terrible headache. No headaches anymore. I get up, it's like, all's good. I don't write everything down anymore.
Okay.
And I don't fall asleep during the day.
Okay.
I seem to have more energy. My blood pressure has gone down.
Awesome. Okay.
Which was good because I did have kind of like uncontrolled to a point. But I still do have blood pressure issues, but I'm down to like 1 medication versus 4 a day. So that has helped a lot because of the sleep I'm getting. And all in all, just more energy, more ready to go, do everything, And it doesn't bother me to get up at 4:30. I try to go to bed every night by 10. Sometimes earlier if I'm tired, and I'm actually getting tired now to where I say, oh, it's 9:30, but I think I'm going to bed. And so I just go to bed and wait for the alarm to go off.
Awesome. Now tell me a little bit about your first night after you got your surgery. I think you shared with me that you dreamed.
Oh, my sleep test.
Yes.
Yes. After things had healed and all that, I had to go for my sleep test.
Okay.
And they wire you up to everything. Everything is wired. And so I normally sleep on my left side. So I went to sleep. Well, the next thing I know, they're waking me up. And I said, oh, okay. And Melissa was her name. She was with Inspire.
Okay.
And she came in and woke me up. And I said, I know you're not supposed to tell me the results, of the test. I have to wait. I said, but it just seemed so different. And she said, honey, you didn't move. You didn't move. And before I was tossing and turning and getting up and tossing and turning. I didn't move because I noticed when I woke up I was still on my left side. And I thought, this is strange because it just didn't work that way. And I dream now. Okay. And I wasn't dreaming. Okay. I don't know. I think Inspire has a lot to do with that because I think you have to get to a point in your sleep pattern to dream. Okay. And I obviously wasn't getting there. And now I am. Whatever that is, I'm there. Okay. So I just sleep so much better. I don't toss and turn. I actually can have dreams. I have energy. I don't have headaches.
Okay. And you still work a full day, 8-hour day?
I work 9 hours a day.
There you go.
Yes, I leave the home at 5:45 in the morning and I get home at 5:30 at night. Okay.
Okay. Yeah. And you're functioning perfectly?
Doing well. Oh, yes.
Awesome. Dr. Nord, we just experienced daylight saving time. Okay. Lost an hour. What are some of the struggles that can present themselves when it comes to staying on track with rest during this time? Maybe during this week in particular when we're still trying to maybe catch up?
Yeah, well, I think, if you're talking about in general, what can you do better to get better sleep? A lot of people talk about sleep hygiene. Okay. And essentially that means certain decisions that you can make to give yourself the best rest possible. Okay. And one of those is going to sleep and waking up at the same time every day. Okay. Your body has a natural kind of rhythm and cycle to it. And certainly when, you start having to wake up an hour earlier all of a sudden, you end up waking up in a much deeper level of sleep typically. So you'll notice that when you wake up, you're a lot groggier than normal. Because if you're sleeping 8 hours a day, you're going to sleep at a certain time, waking up at a certain time, your body gets in a natural rhythm to where you may find that you're just waking up, before your alarm clock, for instance, just a few minutes before your alarm clock. And that's because your body is in this natural rhythm to where by the time you're ready to wake up, you're in that really lightest stage of sleep. Okay. So certainly something like daylight savings time where you throw off that natural pattern, that's what happens. It throws that off, and it's just going to take some time for you to adjust to it.
And let me ask you, when you wake up with a particular pattern, like before your alarm clock, for example, does that mean that you are actually fully rested, or is it just your body clock just kind of programmed to do something at the same time?
Hard to say. I mean, I would go back to saying that in general, people need about 8 hours of sleep. But certain things can change that. For instance, if you take a nap
Okay.
during the day,
Okay.
you're probably going to not sleep as long
I see.
at night.
I see.
Any medications you take, or certainly if you consume alcohol, that can interrupt your sleep to where
Gotcha.
you wake up at a different time. So you got to look at those type of factors.
Different variables.
Yeah.
Okay. Okay. In addition to treating sleep apnea medically, what other types of services or opinions would you offer to people before they seek medical treatment? Like, are there some things you can try to do on your own before you say, maybe I need to take the next step?
Yeah. Now, for me, I would say a lot of times by the time I'm seeing someone who's been referred for sleep apnea, typically they've already gone through a number of those type of procedures. But in order to sleep better, again, sleep hygiene is important, getting enough sleep. Because even if you do have sleep apnea and on top of that, you're only getting in bed for 5-6 hours a night, that's going to make your symptoms a lot more severe. Avoiding alcohol, avoiding sedating, sleeping medication, because that results in making your airway even more collapsible, essentially. There are certain positional therapies. For instance, sleep apnea is typically worse on your back than it is on your side. Because on your back, everything tends to fall back with gravity, like your tongue, for instance. So people may find that if they sleep on their sides as opposed to their back, or sleep on a few extra pillows, that helps a little bit.
Okay.
Yeah.
I remember in doing some research that I was reading that even taking a look at your diet before going to bed, like not eating very sugary things before going to bed, or not eating things that are very salt laden before you go to bed, because those are things that kind of give you more energy, whereas that may be a particular hour where your body should be winding down. So
yeah, I mean, you definitely should avoid caffeine for at least 12 hours. You should avoid alcohol. You should avoid exercising after about maybe 2 p.m. or so. So if exercising is really good for sleep, but if you go for a 3-mile run at 8 p.m., you're going to find it's hard to fall asleep at 10 o'clock.
Okay.
So that's something you can definitely think of. Spicy foods, anything that's going to, not going to sit well and digest well, certainly. And I wouldn't eat a heavy meal before going to sleep, before about 3 hours before going to sleep.
Okay.
You need to be up and kind of awake and let your body process some of that food before you go to sleep. If you are hungry, before you go to sleep, I think it's fine to eat a light, healthy snack. Okay. But I certainly would stay away from eating like a heavy meal before.
Okay. Good advice. Good advice. In addition to treating sleep apnea, what other types of services are available here in your Colonial Heights office?
Yeah, so I see patients here at Colonial Heights, but also at Nelson Clinic in Stony Point. Okay. But we offer the full spectrum of ear, nose, and throat issues. We treat any conditions, really. So I treat adults and children. So for children, it could be anything from chronic tonsillitis, ear infections, things like that. For adults, I treat sinus conditions, nasal complaints. I treat thyroid disorders, any types of lumps or bumps that are growing on the head and neck I can treat. And certainly ear problems, difficulty hearing. I see a lot of patients who notice problems with their hearing or ear infections, and we're able to treat and see those people and often get their hearing tested at the same time as their procedure, as their appointment.
Okay, all right. Ms. Crowder, is there anything else you wanted to add about your treatment and how you're feeling?
Oh, as far as the treatment is concerned, I thoroughly enjoyed the stay at the hospital. Okay. The doctors, the residents, the nurses were all very professional, very caring. I mean, they really, really seemed to care, and they were interested, of course, in what was happening, so we talk about that. And Dr. Noyd is just fantastic. He explains everything. I knew what was going to take place and what should happen afterwards, and it did. The whole experience was fine. I had no problems, no questions that were answered. Everything went well.
Okay. And how often are you back here to get checkups and follow up?
Well, I had my surgery in July, and I saw Dr. Noyd in December, and he told me that unless I had issues or questions, I could come back in a year, and we check everything out, make sure everything was good.
Okay.
Yeah. Typically after surgery, we let everything heal up for about a month or so.
Okay.
So I will see a patient back in a week or so, check the incisions, make sure everything's healing up fine. And then we activate the device or turn it on about a month after surgery.
Okay.
And that's when we explain everything, how to use the remote, because even though it's fairly simple, it is
adjustable.
Yeah.
Okay.
It is a gadget. Yeah. So you can actually turn the level of stimulation up or down.
Okay.
They set this for you and show you how to increase it if you feel you need the increase, which I haven't had to do.
And an increase would involve more
stimulation to the tongue.
Okay.
Through the little lead that comes up here, you can actually feel it.
Which gives you a deeper sleep, or
no, it's more stimulation to the.
It wouldn't necessarily. So she's been already tested, and we've found the kind of the best level of stimulation. We don't want it to be so high that it wakes her up.
Okay.
And we don't want it to be so low to where it doesn't work. So we find that sweet spot.
So we found that sweet spot, and they said it. Now they said if you need, but don't go any higher than this.
Okay.
And they gave me a chart. I mean, everything was explained just to the T. So if something should, worry me or alarm me, I could come to him and say it's not doing the same or whatever, and we can adjust.
Yeah, so it's adjustable. So if someone's sleep apnea were to get any worse over time, there's a number of different things that we can tweak with the device to help with that, which is another advantage of it, really.
Okay.
Yeah.
And is there anything in particular that causes sleep apnea or puts somebody more at risk than another person?
That's a good question. There's not any one thing.
Okay.
It goes back to what I think I said in the beginning. First thing I do is look in someone's airway and kind of assess how much space there is.
Okay.
So certainly simple things that you can imagine, things like large tonsils, a big tongue, a small mouth to fit those structures. Those can certainly contribute to it. As you become heavier, you're more likely to have sleep apnea.
Okay.
So certainly weight goes into it, but I have many patients who are quite thin and still have severe sleep apnea.
Okay.
So there's no one thing. It's patient specific.
Okay.
And so that's why we have to look at each patient individually.
Okay. All right. Was there anything else you wanted to add about Ms. Crowder's treatment, about how people can get more information?
Yeah, no, she's a great patient.
About Inspire.
And I'm glad she did so well. I was really happy that we tested her after surgery, and she had no clinical sleep apnea, so she was a cure, which was awesome.
Okay.
And I'm just excited to offer this procedure to people in the area.
Okay.
And I think it's really beneficial for people.
Okay. Awesome. Well, thank you both so much for joining us.
Yeah, thank you.
Okay, and thank you all for joining us as well. Please check out the next Facebook Live that we'll have. Thank you.